Welcome to our first video on movement disorders. Let's begin. In this lecture, we will discuss Parkinson and Huntington disease. We will discuss the definition, clinical features, diagnosis, and management. Parkinson's disease is a neurodegenerative disorder. It is caused by loss of dopaminergic neurons in substantia nigra. Typically, the affected patients are above 40 years of age. To remember the main clinical features of Parkinson's disease easily, we will use the mnemonic TRAP. So let's see what these four letters stand for. First, T stands for tremor. The tremor in Parkinson's disease is a resting tremor that is apparent when the body part is relaxed. It is sometimes called pill rolling. Importantly, it is asymmetric at the beginning of the disease, affecting one hand, and can extend to affect both hands later in the course of the disease. In fact, this resting tremor is the most common presenting symptom of Parkinson's disease. Second, R in TRAP stands for rigidity. This is noted as increased resistance to passive movement around a joint. It can be lead pipe rigidity or cogwheel rigidity. Here is how the lead pipe rigidity looks like. Please notice how the passive movement around the elbow joint is stiff and rigid with steady resistance through the range of motion. Here is how the cogwheel rigidity looks like. Notice how the passive movement around the elbow joint is stiff, jerky, and ratchet-like through the range of motion. Also, here is how the pill rolling tremor of Parkinson's disease looks like. Please keep in mind that it is most evident during rest. Let's continue the TRAP symptoms. A stands for akinesia or bradykinesia. The patient has generalized slowness and complains of reduced ability to initiate movements, for example, standing up from a chair. A narrow-based shuffling gait is noted. Also, micrographia, which is abnormally small-sized handwriting. Hypomimia, or masked faces, which is the loss or reduction of facial expressions, and hypophonia, which is the abnormal softness or weakening of voice, all related to bradykinesia and can be seen in a patient with Parkinson's disease. Here's how the shuffling, narrow-based gait of a Parkinson patient looks like. Finally, P stands for postural instability. It is usually a late manifestation. The patients lose the centrally mediated postural reflexes and therefore complains of flexed axial posture as well as recurrent falls. Other clinical features that may be seen in patients with Parkinson's disease include mood disturbances, most commonly depression. Dementia can occur in late course of disease and presents as psychomotor retardation, memory impairment, and altered personality. Autonomic dysfunction may also be encountered, such as constipation, dysphagia, urinary and sexual disturbances. A 67-year-old man is brought to the physician by his wife due to recent behavioral changes. 3 years ago, the patient started having pill-rolling tremor at rest, shuffling gait, and stooped posture. 1 month ago, he started having memory problems. He cannot recall the name of his wife and sons. He sees small creatures running around his house when there's nobody there except his wife. How can this patient's condition be differentiated from Lewy body dementia? The patient started having pill-rolling tremor at rest, shuffling gait, and stooped posture 3 years ago. This description is consistent with Parkinson's disease. Now he has memory problems. He cannot recall the name of his family members, and he has visual hallucinations. Since the time between the motor and cognitive symptoms is more than 1 year, his cognitive decline will be called dementia secondary to Parkinson's disease. Lewy body dementia presents similarly, but the time between motor and cognitive symptoms is less than 1 year. Let's see this patient who's diagnosed with Parkinson's disease. His arms are adducted, and when he walks, arm swing is barely seen. He has postural instability and a stooped posture that results from flexed position of large joints. His gait is shuffling with short steps. Let's also note the tremor of both hands at rest, as well as the micrographia. Finally, he has hypomimia and seborrhea. Let's move on to the diagnosis. Actually, the diagnosis of Parkinson's disease is dependent on clinical findings. There's no single test that can make a definitive diagnosis of Parkinson's disease. Let's now discuss management. The classes of drugs used for patients with Parkinson's disease are high yield, so let's pay particular attention to this discussion. The first and most important are levodopa and carbidopa. These are the first-line therapy for moderate to severe symptoms, especially when the patient is above 65 years of age. Remember that carbidopa is used to inhibit the peripheral conversion of levodopa to dopamine. Early side effects of these drugs include nausea, dizziness, hallucinations, and orthostatic hypotension. Late side effects include dyskinesia, which is involuntary movements. Remember from step 1 that levodopa is associated with on-off phenomenon. The patient complains of episodes of improved mobility on period and impaired mobility off period. Second, we have dopamine agonists, which include pramipexole, ropinirole, and bromocriptine. These drugs can be used for moderate to severe symptoms in patients that are less than 65 years of age. Side effects include somnolence, dizziness, hallucinations, edema, and impulse control disorders such as pathology gambling. Let's continue with the classes of drugs used for Parkinson's disease. We have monoamine oxidase B inhibitors, for example, selegiline and razegiline. These can be usually used for mild symptoms. Amantadine, which is a viral agent, is an alternative to MOA-B inhibitors. Side effects include livedo reticularis and ankle edema. Here's an image showing livedo reticularis. Please note the purplish skin discoloration that takes a reticular or lace-like shape on the lower extremity. As we mentioned, this can be seen as a side effect of amantadine. Finally, we have anticholinergic drugs such as trihexyphenidyl and benztropine. These are typically indicated for young patients who have the tremor as a dominant symptom. Side effects resemble the antimuscarinic manifestations, which include constipation, dry mouth, and urinary retention. Let's now move on to our next topic, Huntington disease. We will discuss definition, clinical features, diagnosis, and management. Huntington disease is an inherited neurodegenerative disorder. The type of inheritance is autosomal dominant. It is associated with CAG trinucleotide repeat sequences in HTT gene on chromosome 4. In this disease, there is loss of GABA-producing neurons in the neostriatum. Let's discuss clinical features. The onset of symptoms in Huntington disease is gradual, usually between 30 and 50 years of age. They include chorea, psychiatric disturbances, dementia, as well as weight loss and cachexia. Chorea is purposeless, brief, involuntary movements that can involve trunk, limbs, and face. Also, some of the psychiatric disturbances that the patients usually complain of are irritability, depression, and antisocial behavior. Here is how the chorea looks like. Please notice the brief, involuntary, and purposeless movements that involve both the upper limbs. Let's try a question. A 45-year-old man is brought to the physician by his wife due to recent behavioral changes. He became very aggressive towards his wife and son. He seems depressed with a flat affect. The physical exam reveals writhing, slow finger movements and occasional purposeless arm swings. The patient's father suffered from similar symptoms. What can be assumed about the onset and severity of the same condition in the patient's son? This patient is aggressive and depressed with a flat affect. The physical exam finding of writhing, slow finger movements is consistent with athetosis. Occasional purposeless arm swings suggest chorea. Considering that his father suffered from the similar symptoms, this patient likely has Huntington's disease. Let's recall that Huntington's disease, just like most of the other trinucleotide repeat disorders, is characterized by anticipation. Anticipation means that the earlier onset of more severe disease in the patient's offspring due to triplet expansion during gametogenesis. The diagnosis of Huntington's disease is based primarily on family history and clinical findings. However, MRI can be performed. It shows atrophy of caudate nucleus and putamen. Also, to confirm the diagnosis, genetic testing can be considered. Let's see this MRI of a patient with Huntington's disease. It clearly shows the atrophy of the caudate nucleus. Finally, there is no specific therapy of Huntington's disease. The management is actually supportive and symptomatic, and the survival is estimated to be 10 to 20 years of life after the symptoms onset. Let's end this lecture with another question. A 62-year-old man comes to the physician reporting recent worsening of his involuntary movements. He was diagnosed with neurodegenerative disorder 5 years ago, which is controlled with a medication. He reports episodes of complete immobility as if he is frozen, followed by episodes of improved mobility. His vital signs include temperature of 37 degrees Celsius, a blood pressure of 145/90, heart rate of 85, and a respiratory rate of 15. Physical exam reveals bilateral hand tremor at rest, narrow, shuffling gait, and expressionless face. What is the most likely medication responsible for this patient's current symptoms? A. Levodopa-carbidopa. B. Amantadine. C. Ropinirole. D. Benztropine. This patient reports recent worsening of involuntary movements. Physical exam reveals bilateral hand tremor at rest, narrow, shuffling gait, and expressionless face. These findings point toward the diagnosis of Parkinson's disease. He reports episodes of complete immobility as if he is frozen, followed by episodes of improved mobility. This description is consistent with the classic on-off phenomenon associated with the long-term use of levodopa-carbidopa. Therefore, the correct answer is option A. Here's the slide reminding us of the side effects of levodopa-carbidopa. Let's discuss why other options are incorrect. Option B, amantadine, is incorrect. We learned that its main side effect include levato reticularis and ankle edema. Option C, ropinirole, is incorrect. The side effects of ropinirole include somnolence, dizziness, hallucinations, and impulse control disorders. Finally, option D, benztropine, is incorrect. This is an anticholinergic medication that can cause dry mouth, mydriasis, urinary retention, and constipation. And that concludes this section.